Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. We sure appreciate when you can come on live. And if you can, say hello to us. And if I can see my scroll this morning, I will say hello to you. Yeah, there you go. Brahim from Portland, Oregon. How are you, Brahim? Thanks for coming on this morning. We sure appreciate you. Nellie, right at the top, Nellie. Good for you. How you doing? And Lynn from Aurora. Janice from Brampton. Good morning to you. And Brahim's having his coffee. And so am I. Elaine from there you go. St. John's, Newfoundland. Kevin. Sherry. How are you, Sherry? Yvonne? Petawawa, Lori from Alberta, good morning to you. Sandy from Fergus Falls, Minnesota, thank you for joining us this morning. Kathy, Port Perry. Bonnie in Little Britain. Amber in New Jersey, good morning, Amber, how are you? Therese, bon matin. Bonnie, good morning. Fran, Orangeville, how are you, Fran? Georgie, Halifax, Nova Scotia. Dear friends to the program, Grace from the Rock, Newfoundland. Hello. Bonjour, Carol. West Virginia. Catherine. Springdale, Newfoundland. Diane, Peterborough. Lori, just got back from Mexico. Okay, Brandon. And Craig and Darla in Indiana. Leela from Verner. Marianne, Dennis from Norwich, Nativity, good morning to you. Kelly, London, Ontario. Karen, Innisfil. Carol, Moncton, New Brunswick. Helga, good morning. And Family Day back in Ontario. Yes, Laurie, Cambridge. Anne, Moncton, New Brunswick. Steph, how are you from Cambridge? And Fran from Tilsonburg, Patricia from Pulaski, Tennessee, Marilyn from Charlottetown, PEI, Francis, Carrie from Nebraska, how you doing? Dave from Gilmore, Judy, New Brunswick, Linda, oh, those Lindas, we love them from New Brunswick, and Rosalinda, I don't know what happened there, Rosalinda, says her scroll wasn't working. Kathy, Danny Lay, Iron Bridge, Denise, Sharon from Michigan, and John from Hamner. How are you? Cindy, Lori, a couple of more guys. We got to get going with our questions. Carol, Mount Pearl, Newfoundland. Milika from Stouffville. Good morning. Lise, how are you? And let me see, one more. Margie from sunny warm, Kansas. Hi, Judy. And Shirley, Twin Gate, Newfoundland. I hate to miss anybody. Hi, Cheryl. And Donna from Florida. Good morning. And yeah, having your coffee, enjoy. Okay, hi, Mara. How are you doing? Okay, let's get to some questions here. I think we left off on Friday with George. And let me see, where was that? Right here. Okay, so the next one is Michael. And Michael is saying he's got dry skin on his knuckles. And they're cracked and they keep coming back. He's taking omega-3 and flaxseed oil. Well, look, here's what I would do, because anytime you see like that cracking there, I'm always suspicious of leaky gut. Okay, and it's constantly, you're in moisture, probably, or sweating. I'm not sure. But usually when that stuff is not healing and coming around, ordinarily have a look at possibly fungal. There's yeast there. And so I would add probiotics, oil of oregano. Put it right on the skin and actually take some internally. That's what I would do. And for healing, you might, again, like what's causing it. Generally, again, I don't know your work and what's happening there, Michael, but those are the things that I would add to your regimen to get rid of that, okay? By the way, I'm not big on flaxseed oil. You know me, I love flax seeds because of lignans, but I don't like the oil near as much, okay? There's better oils out there. And one of them is oil of oregano. But flaxseed oil, I know it's got omega-3, but it's not near as bioavailable as your fish oil is. Anyway, that's just aside, okay? Okay, that was Michael. Sue, what is familial cholesterol? Is something to be concerned about? Well, again, if you're with me, Sue, you're barking up the wrong tree. I shouldn't say I'm not big on cholesterol. That wouldn't be true because I like cholesterol, but I like it to be high. Look, if you look at all the research, especially the new research on heart disease and that, you gotta look, the best biomarkers in your blood is to look at your triglycerides and your cholesterol, HDL cholesterol ratio. Because when you look at 93% of the population have some form of metabolic syndrome. That is at the root of heart disease, much more than cholesterol is. And I'm not saying I don't look at cholesterol. I sure do. But I don't care so much about total cholesterol. And I don't care so much about LDL. Not that I don't even look at it. Because if you don't want an immune system, then you hammer down that LDL cholesterol. But again, I always sort of say it's looking for love in all the wrong places. Heart disease, if you look at it, and is a metabolic thing. It's how your body uses energy, and that's why I love to look at, when it comes to heart, I want to look at your A1C, I want to look at your triglycerides. Triglycerides should be low, and the HDL cholesterol should be high. And when you get metabolic syndrome, it's reversed. Your triglycerides go through the roof, and your HDL, and that is very dangerous in terms of heart disease. Same thing with inflammation, systemic inflammation, silent. That's why I like CRP, C-reactive protein numbers. Very important for that, okay? So, yeah, familial cholesterol is, some people make a lot more cholesterol, but when you look at their statistics, they're not any more susceptible to heart disease than the average population. And why is that? Because, again, it's not just cholesterol. Cholesterol, you don't want it to be low. HDL, look at those two numbers, okay? In my book, Sun, Steak, and Steel, I explain all the blood work and what you should be looking at in blood work, okay? So, anyways, thank you for the question, and that was, hold on, let me get back here. Michelle, I think. No, that was Sue. Manik, okay. Manik, you're going to ask a question that a lot of people ask. Dr. Martin, you love L-reuteri and L-rhamnosus. Why don't you put them in your formula? Well, they're there. Okay, they're there. And I've explained it in the past. Okay? And because at one time, we were trying not to have our formula copied. Okay? Companies were trying to, because of the popularity of our formula, our probiotic formula, they were trying to copy it. Okay? And they're there. They're in the immune. Like if you look on your label of our probiotics in Canada, they are on the immune portion of the formula, okay? They're L-reuteri and L-rhamnosus. Look, I love those two bacterial strains. I've been talking about them for years, and yes, they're in our formula. We tried to hide it because people were copying it. Anyway, okay, it's there. Believe you me, because I've been talking about probiotics for 40 years, right? And the more research they do on probiotics, it's amazing what probiotics do. Friendly bacteria. And now mainstream medicine, they see it. Their studies on the microbiome, guys, are incredible. And why, look, all those strains are good and they're on your side, but there's been a lot of research on L. reuteri and L. rhamnosus. And they're really antifungal, okay? They're anti-parasitic. They are very powerful 2 strains. They help your body chelate, okay? Research has shown they help your body chelate heavy metals out of your body. So that's why I love them so. But I was trying to hide them. And that's why you're asking the question. But I assure you, they're in that formula, okay? Thank you for the question, Manik. We appreciate it, okay? And we didn't mean to fool you, but that's what's happening, okay? So that was Manik. Another one, Manik, now could be the same one? I don't know. Okay. Asking about BPC 157, okay? So those are peptides, okay? It's the new thing, are peptides. You'll see it all over the internet. And remember, Ozempic, Wegovy, those are peptides, okay? They're taken from the gastric portion of the body, and these peptides are they're becoming very popular. BPC 157, okay? Weightlifters are using it, muscle builders are using it, there's anti-inflammatory properties to it, and the research is pretty compelling, okay? So you can inject and you can take them in supplements. I'm not sure of the bioavailability of the supplement of those peptides, whether they're as effective. I don't think so, but the jury's still out, okay? Thank you for the question. That was Manik, and might have been 2 Maniks, might be just one asking 2 questions. Okay. June, asking a question about her scalp, small little sores. Go back, June, I suggest leaky gut, leaky skin, leaky gut, leaky scalp, usually fungal. Go back to the gut, okay? That's me. I did it in my practice for years. You see stuff on the skin like an eczema, psoriasis, or whatever, leaky gut, fungal. It's the invasion of the Third Army. And it can get into your lungs, it can get into your sinuses, it can get into your skin, it can get onto your scalp. I would add, like you're asking about shampoo, I would add some oil of oregano. Put a couple of drops in your shampoo. And, there's all sorts of natural, like tea tree oil is good too, shampoos. Add a couple of drops of oil of tea tree oil is good. Oil of oregano is much stronger than tea tree oil. So add a few drops. It's good for your hair. Remember, oil of oregano is an antioxidant too. Very powerful. Okay? That was June. Doreen, constant runny nose, but quercetin hasn't helped yet. Okay, because quercetin I like quercetin, Donna, with I love it in combination with Navitol, okay? Because they're both natural antihistamines and they are so good for you. Now, if you have a constant, either a postnasal drip or a constant runny nose, I'm very suspicious of fungal. Again, I come back to that yeast it's all throughout your sinuses. And your body's smart. It's just trying to drain that. And the problem is it can be a pain because you're always, you got a runny nose. Try adding, like I like the Navitol with it, as long as you're, treat it as leaky gut too. Okay, a yeast, a fungal, usually they go together. So you gotta hit it from every way. Lay off the sugars. Don't feed the bears if there's yeast there. Probably is fungal. Okay, don't feed the bears. Lay off the sugars too. That is Doreen. Rita, any suggestions, please, as to what to eat to get over stomach flu? Well, look, now you're going to be a very base, this is where you're probably going to have a little bit of carbs, like I used to have patients, and then when they had the stomach flu, could they take a little bit of yogurt? Maybe. Very base, don't eat a lot. You're almost fasting. A little bit of applesauce. You can go for it for a couple of days just to make sure that stomach is really, really settled down, okay? Put a few probiotics if you can into the applesauce or whatever. If you can take a yogurt, even better, but sometimes you can't. You just got to grin and bear it and go through it. And very, very bland. Like you can have a banana for sure. Bananas usually are, they're sweet, but, like for a few days, go for it. I got no issue with that. Okay? And that was Rita. Thank you, Rita. Lucille. Question for cortisol formula for sleep. When to take and how many? Currently taking one in the morning. Well, look, if you're having trouble sleeping, one of the best formulas, I think it is the best formula ever, is the cortisol formula. Okay, remember now, okay, we just do a little teaching on cortisol. Cortisol is part of your circadian rhythm, meaning your cortisol is going to go up in the morning to wake you up. So that's normal. With all the stress that we have in the world today, you don't want cortisol at night. That's the problem, is people are wound up. Okay, they're wound up at night. And cortisol formula is a all natural, lowers cortisol at the right time. So if you've got big time stress in your life, you take it during the day, 1 a day if you want, 2 a day. I've had people take a couple of capsules. I used to tell patients this all the time. Save a couple of capsules before you go to bed at night. If you're under an enormous amount of stress, you might be taking 4 or 6 cortisol a day. But, I love it in terms of taking it at night too if you're having trouble sleeping. Because what cortisol does, it might allow you to get to sleep, but it's not going to allow you to stay asleep. And if you don't stay asleep, your glymphatic system, your brain, will not detoxify. Isn't it amazing what we know about sleep today that I didn't know when I was in school? You actually have a self-cleaning oven in your brain. It's called the glymphatic system. It's separate from the rest of your lymphatic system. But it only works when you're sleeping. And 70-80% of the population have trouble sleeping. It's amazing. So, cortisol formula is a tremendous sleep aid if you need it, okay? It's a tremendous sleep aid because it levels out in the adrenal where you're secreting cortisol. It levels it out. So if you're having trouble sleeping, you can take a cortisol formula during the day because it's actually good for you to calm you down. It takes you out of that fight or flight. Okay? And you don't want that turned on 24/7. That's what's happening in this world. And so if you save some at night, take another capsule or two. I've had tens of thousands of people. Okay? Magnesium is good too. It is. I find the cortisol formula even to be more effective than magnesium, and I love magnesium. Okay? And tens of thousands of people will testify, give credibility to what I just said. Okay, that was... Okay, let me get this over here so I can see the questions. And, okay, hold on. That was Rita. No, that was Lucille. Okay, this is someone that didn't give us their name, and that's all right. Talking about, okay, at the end of the day, I know Dr. Martin doesn't recommend estrogen, okay? But if I have an issue of vaginal atrophy, my understanding, low-dose topical estrogen creams act locally with minimal absorption into the rest of the body. Well, look, okay? Let me reiterate where I'm coming from, okay? I don't like estrogen at any time given. I know a lot of women use it, okay? But you can't convince me about it. I've been around too long. I've seen way too many cancers, and estrogen is a cancer driver. Now, a local topical estrogen for vaginal atrophy, I don't like it. To be honest, I'd rather that you use a bioidentical progesterone rather than estrogen. Again, because my thinking is this. We get way too much estrogen. It's everywhere. It's in everything. I mean, you can't run. You can run, but you can't hide from estrogen. It's everywhere. For men and for women, and especially women's body. That's why I don't like it. I don't think you need to add any estrogen. And I know there's a lot of doctors that say that you should, gynecologists and that. I just beg to disagree. I see too much cancer. Like, why do we see so much breast cancer today? Why aren't we winning the war on breast cancer? When I was in school in the 70s, breast cancer was 1 out of 20 Canadian women and American women. Today it's 1 out of 5, 1 out of 6. Prostate cancer is an estrogen-driven cancer in men, not testosterone, the opposite. Testosterone is sinking like the Titanic, and estrogen is high in a man. And then you combine that with insulin, and we got a big problem in the world today. So you got a big problem with estrogen, and you got a big problem with insulin because of the food we eat. I mean, the only time you ever talked about insulin in the 70s was if someone was a diabetic. And today, we talk about insulin every day because it's a growth hormone. It's a big problem. It's the food we eat. So you got insulin, you got estrogen. Like, to me, I just don't like the use of estrogen. I don't think it's needed, even in a low-grade topical cream. I'd rather you use progesterone. I'm always trying to dim out estrogen. I dim it out. So I just have a hard time changing my mind on that. I read all the research, and I'm not convinced that any woman in this universe needs estrogen. You got lots of it. Even though it's coming down, I understand. Menopause, it comes down. But it's always that balance between estrogen and progesterone. I just don't like it. Okay. Thanks for the question. That was Anonymous. Okay. Micheline, the bone powder has no gelatin. Well, bone broth powder, okay, or bone broth, is the best collagen protein that you can get. You just can't get better. And dried bone broth, we make it easy for people. It's got all the essential amino acids. Very, very, look, just read the testimonies. Tens of thousands of people, they see the benefits. Hair, skin, nails, their gut. Bone broth's so good for the gut because of L-glutamine. So, of course, it's still good for you. Jay, what did Dr. Martin think about reverse osmosis water? Yeah, I got no problem with it. I really don't. Again, I'm big on H2O. You guys know that. Vitamin W, water. I'm big on it. I like spring water. What is the best water in the world? Spring water. Okay? You want to reverse osmosis? I got no issue with it. I don't like distilled unless... I don't like it, particularly because you got no minerals in it. And water naturally has trace minerals in it. Spring water. But doesn't mean you can't drink, I want you to get 2 liters or 64 ounces of water every day. Every human being, in my opinion, on the planet needs that amount. And not just my clinical experience. Otherwise, you're going to be dehydrated. That's why I like adding a pinch of salt to water. It's good for you. But mineral water, spring water, is the best water. Okay? But I got no trouble with reverse osmosis. Okay? All right. Okay. Well, this is Barbara asking the same thing. Does anyone know what Dr. Martin thinks of trace mineral drops in our drinking water? I got no problem with it. If you're drinking, folks, don't drink water from your tap. Filter it, okay? Get a filter. You got to take all the garbage they add to water today. Take that out of it, okay? Take that out, clean it out. And then you can add drops of trace minerals. I like trace minerals. Like I said, why do I like spring water? Because they got trace minerals in it. You got your sodium. You got your magnesium. You got your potassium. They're in just trace amounts. But it's the way water, that natural water, comes like that. Okay? So yeah, if you want to add a few drops of trace minerals in your water, I got no problem with that. Lisa, why would cortisol control lower my blood plasma? I really don't, Lisa, understand the question here. Okay, what do you mean by your blood plasma? What do you mean it lowers it? Okay, your blood volume? Why would it do that? So what I'm asking you, Lisa, before I answer the question, send me at info@Martin Clinic. Send me what you mean by that. What's happening to you? Okay? It's saying it's dropping your blood plasma. Are you getting low blood pressure after taking cortisol? You shouldn't. I can't say that I ever heard of it before. Okay? But I need to understand what you're asking me there. I just, I need more detail. If I had you live, I would ask you right to your face. What do you mean by that? Your blood plasma. How do you know it's lowering your blood plasma? Okay? And what do you mean by that? Okay. All right, let's see. We're getting there. Well, we got a lot more stuff here. Jackie, what does Dr. Martin teach about additional amounts of vitamin D for MS patients? Yep. Well, look, I mean, I'm only telling you what the research shows because they've shown that MS occurs, it occurs everywhere, but in, like, if you look, and this is facts, you look at what part of the planet you live on. If you're in the northern hemisphere, your chances of getting MS are much higher than if you live in Florida, for example. It's just the facts, not that the Floridians can't get MS. They just get it at a lesser rate than we get it up in Canada, okay? Why is that? Well, you have to look at vitamin D, and this has been studied. So I'm big on vitamin D. You guys know that. And I would have before, look, vitamin D is safe to take as a supplement, so you don't have to worry about that part of it. But I really do encourage people to find out what their vitamin D levels are in their blood, because it's science, guys. It's science. You can measure vitamin D in blood, your dehydroxy levels. And I find, like, if I had a patient that had MS, I gave them vitamin D for sure. I recommended that they took it, but it was especially if I had their blood work, because then you guide their blood work into a much better level, because usually what you saw was they were extremely low. But join the club. Millions of people are low in vitamin D. They're not optimized. See, there's a difference between having normal vitamin D. Oh, it's normal. Yeah, but it's not optimized. And that's really important. Okay. Okay. Somebody else asking a question about PPIs. Okay, let me just do... I'm going to talk about PPIs again because there's a boatload of side effects with proton pump inhibitors. I mean, there's not even a question about that. The research is overwhelming. And even mainstream media now is talking about, like, PPIs were meant to be very temporary, not long term, because you're not absorbing. You're starving those proton pumps from working properly. You're lowering acid. Yeah, it helps with your acid reflux for sure. But the biggest problem is by turning off that acidity. Remember, your stomach is the only place in your body where you should be very acidic. Very acidic. The problem is that if you're not acidic enough, your body compensates, and these proton pumps in your stomach start producing more acid, and that acid, unfortunately, doesn't stay in your stomach. It starts crawling up the esophagus. That's a big problem. I mean, millions and millions and millions of people every day get trouble with acid reflux. But you don't want to just, try and hide the problem, because you're not fixing it. So let me go into a little bit more detail, because there's new findings on the topic. It ain't good. The more they research it, these PPIs, it's not good. It's worse than we thought in terms of side effects. Okay. Let me see. I think we are just about done here. There's a few others I want to ask. Okay. You know what? I'll answer some of these questions tomorrow. There's a couple of more here. I'm just looking to see. Yeah. I think what we'll do is we'll wait. I'll answer a few more. Some of them are just because I need more detail anyways in the question. So we'll leave that, and we'll touch on the ones that I haven't done yet. Okay, so tomorrow, guys, plan afternoon session. Okay? Afternoon session. Tuesday. Okay? Rebuild Your Temple. You got the book. In Canada, you can still get the Sun, Steak, and Steel book. Okay? I know many of you have taken advantage of that. Okay? And have a great day, guys. Enjoy your day, and we love you dearly, and we'll talk to you soon.